Go to town, 822. It's the link on the breeze, 93.9. Sabrina and Chris here. Good morning. Coming up at 9, we'll do our D 2020, but let's keep it going on our Zoom feed. We'll bring on Teresa Ariola, who is the director over at the Guam Behavioral Health and Wellness Center. Good morning, Teresa.
You there?
Good morning, everyone.
Good
Thank you
morning.
for having me.
Of course, our pleasure. I guess we'll just go ahead and start with a release that you guys had put out about Guam's emergency response for suicide prevention. There's a grant, right, that was given a COVID-19 emergency response, right?
Yes, thank you so much. Thank you for allowing me to share with our residents good news. Guam Behavioral Health submitted an application to SAMHSA, which is the Substance Abuse Mental Health Service Agency, about, I would say, 2 months ago. And we heard back on Liberation Day. It was actually a wonderful liberation gift in my inbox. And basically, we were awarded $780,000 towards the COVID Emergency Response for Suicide Prevention Grant. And so this is very COVID related. The indicators nationwide shows that during any isolation or quarantine, there is a higher risk and higher number of suicide ideations and calls coming in through crisis hotlines. And as you know, Guam Behavioral Health has always had a crisis hotline, but has never been more active and more known than during the COVID time.
Teresa,
we're very pleased. We're very pleased. It's $780,000 of 100% funding, which means Gov Guam or local coffers does not have to do a match, and it's good for 16 months. And it's to really shore up our services on the crisis hotline, as well as technology that, as you know, is so much needed during these times.
You know, I'm reading the release, and it does say that you guys have seen or saw a dramatic increase of at least 25 people calling a month. That's what almost one every day.
Less than one a day.
Right.
So to about the same amount a day during the COVID time. And that was right after, I think, the first couple of deaths. Of course, I think when Guam heard of the first, we had 5 deaths, unfortunately. But thank goodness there are only 5 deaths. Not that, it's unfortunate there are 5. Wish there were none. But when we heard of the deaths, I think that's when it really settled in. And people started realizing, this is really a serious disease. This is a serious issue that we're facing. I mean, it really hits home when it becomes very personal. And here on Guam, we're a small community, and we take our funerals and as well as our births very seriously. And so we saw a great spike in the crisis center calls right after the initial deaths were announced.
What were they saying when they called,
home.
Teresa? What were those callers telling your people?
Well, so the calls, the calls that came through the crisis line in the early March into April, was basically a show of great depression and anxiety and stress about the news, COVID, the unexpected, depression, major anxiety. Guam is we are used to, one thing that we are we have an advantage of the mainland is that we are naturally know how to pause during a crisis. And so, and that's because we have typhoons. So Guam knows how to pause for 3 days at best, a week. And we've even and some of us have lived through experiences of a month of no water, no power. And so we kind of have that advantage of the mainland because we we know how to pause for a short period of time. When the deaths hit, Guam recognized, I think the community recognized that this is really serious and it's not going away any sooner. And we, you know, so anxiety, major depression. We are a social community. We're not used to just staying home. We are a familial community, society. We're used to getting together with our first cousins on weekends, going to the beach together. Social. We're such a social community that being told to stay home is a foreign thing to us. But our advantage, and national folks have asked me in different national calls, and actually this whole week I was sharing with Chris that I'm in a national conference all morning from 1 to 5 a.m. Started last week until this Thursday. That they asked, how is Guam doing it? And I basically said, because we listen and we live for others. And so really that's, kudos to the community, to the residents of Guam who learned to listen to who took the advice of public health and our leaders here on the island, Governor Leon Guerrero, when she went very conservative in the beginning, it's what helped us how we are today. And so we are, compared to national states, we're doing very well. And that's because our community, honestly, I believe because we live for others. We are masking, we are social distancing, we are washing our hands, not necessary for ourselves, but so that others we love and others we run into don't get sick.
Right. Therese, this affects everybody. So I would assume that this also is taking a toll on your staff and the individuals that are manning this crisis hotline. So are there any kind of services or decompression that they had to go through?
So, absolutely. So Guam Behavioral Health was considered an essential agency. So we've never stopped working either. And so we have been open. We've been open. We've never closed. And so recognizing that my staff are going through the same stressors, same worries, concerns that other people of Guam are, who have the advantage of staying home with their loved ones and finding comfort in that, we immediately, let the word out in our staff that what we're offering the people of Guam, we're offering ourselves. So self-care is something we talk about very often with our employees.
Teresa,
taking care of yourself. So self-care is a big thing in our field.
Is the tone, the content of these calls, has it changed from what you were telling us at the onset and the duration of the lockdown to now? Are you starting to get calls? Because what I'm hearing from people is they're overwhelmed, they're drowning, the bills, banks, collectors, landlords. I mean, now that we're in peak or three and we're back to, the so-called normal, what we're having now is people are facing the realities that we weren't even thinking about because we were thinking we were going to die the last 3 months. So is that kind of like the calls you're getting now?
Right. So exactly. So in the beginning, the crisis calls were more about fear of the unknown, anxiety. How long is this going to last? And then it plateaued. And then every now and then it will spike up again, especially we were doing so well in, 0 every day, zero positives. And then if you recall, sometimes we have these 11 out of the blue, 11 spikes, 12 spikes. Those calls will come in because what's going on? Why are people still spreading the, why is there still a spike when, again, as I mentioned, our community is predominantly very, very obedient. They listen because it's a health issue. We take public health very seriously. So the calls went from those kinds of anxiety, the unknown, to then prior to the federal funds coming to Guam and the programs rolling out, then they became, my bills, concerned about the pressures of, how am I going to take care of my family? But since then, we saw a decrease, and what we notice is the trends show that as soon as the I guess it I forget what it's called, the um, stimulus funding came through, rev and tax, those who have
Yeah.
applied and or sent out their or filed their taxes automatically got a
EIP.
stimulus.
Right.
When the local funding that Governor Leon Guerrero put out started rolling out, then you saw a decrease. So you immediately saw a decrease that people, and so the decrease is an indication that um, somehow they're being comforted and relieved. And so, and it coincides with the release of funding, just like towards like before PUA, the Department of Labor program rolled out for employees who have lost their jobs or lost hours. There was those kinds of calls in the crisis line. But now that PUA is pushing out, you're not hearing those calls anymore. So it's kind of flattening out, and then you got less of a calls when government agencies opened up. And I think it's because they were worried, or they were worried about their power, water getting cut off. But as soon as those authorities gave them some release, public message, comfort that you won't get cut off, those things died down again. So you always saw the trend of the crisis hotline calls run parallel to the announcements and to what's being offered to our residents. And so definitely went from I'm scared, I don't know what this COVID-19 is about, and then it went to what's going to happen. I lost my job, and then those things kind of died down. And so still, because COVID is still around, there's still an uncertainty and concern. So now you're seeing more of the normal calls that Guam Behavioral Health gets: anxiety, depression, things of that nature, especially among folks who are, unfortunately, and this is with one of the main components of this grant, this suicide prevention grant that we just received last week, is the domestic violence component. You saw an increase of calls when you're already living in a domestic violence situation and you have no comfort or relief because you have to stay home with that abuser. And so this grant is going to address those kinds of outreach to those folks who need the help, who are dealing with domestic violence as well. Domestic violence that leads to major depression, that leads to calls into the hotline that they can't handle it. They're thinking of killing themselves.
Therese, how is this money gonna help? Like, what are you gonna buy? What are you gonna spend it on?
Yeah, so $780,000 is going to be stretched out. It's not a 12-month. Normal grants are about 12 months, a year long. This is a 16th-month grant, so we're going to stretch out $780,000 for 16 months, and it's going to shore up our personnel. So we're going to be able to hire more social workers, more psychiatric social workers. We're looking at an additional 6 staff to be hired for a 16-month period, so it's very temporary. And then it's going to also shore up our Wi-Fi and technology needs in the department. And so everything is going virtual. I mean, look at how we're talking now.
Right.
Life goes on, but we're just talking.
Teresa, I wanted
So,
aside from this suicide prevention grant, I wanted to ask, because the Department of Education, they're getting ready to reopen schools on August 17th, and GDOE, they made this
Right.
announcement early on that they received over $40 million in stabilization funds, and a portion of that grant money was going to go towards providing emotional and behavioral and wellness support for students. And so, are you working with GDOE on this?
Yes, we are. We are. Actually, we have a very close working relationship with them through the Lieutenant Governor's School Safety Task Force that has been initiated last year. So those communications, those communication lines have been already established before COVID. And so it was very a natural progression that once COVID hit and they received these funding, we're just partnering with them. And so I've had meetings with John Fernandez and the Lieutenant Governor, who were so they received a pocket of funds, as you mentioned, and you might have heard that they're doing a lot of training with their staff. So that's what that funding is going for, training their staff, getting their staff ready. We are complementing their training, and so we're in the process of developing a video as well as a poster series for the classroom, for those who are going into the classroom, for the children, for the kids. And these are a lot of like self-help, calming posters, breathing exercises. And so one thing I wanted to say is kudos to the Department of Education, because when we first spoke, when we first met about how do we get our workforce, which is the school employees, predominantly the teachers, but not just the teachers, you have administrators and, other support staff that are now thinking they're going to go back to school when they have been out of the classroom and the school property for 6 months, right? Since mid-March. So the anxieties that the workforce goes through when their employer tells them, okay, it's time to go to work, is an anxiety that many people have already dealt with. But now the largest population, the largest employer, Guam department, 4,000 plus employees, are now starting to have to go through that processing. Yeah. They are now starting to have to put in their mind that they're going to come back to the workplace, start interacting with other people who they have no control and must trust that everybody is using preventive measures. Because honestly, you don't know, the one thing about like at Guam Behavioral Health, for example, our department, I know exactly how we're practicing safety, because it's a mandatory masking. I see my staff exercising. We have 6 feet distancing. Every room has a maximum number of people that can be in it because of 6 feet distancing. And so I can say that during the day and during the work hour, my employees are practicing what we're being asked to practice. But there is a level of trust that we need to have because when they go home in the evening or on weekends, I need to trust that they are, as normal residents, not employees of Jibwick, are also practicing the right way, so that when they come into the building, they too are not bringing in, the disease.
Right.
So these employees of the Department of Education are going through that kind of process now, and honestly, it won't be surprising to me. I have heard that some people, and you might have heard, that they're concerned.
Yeah.
Initially, you hear of certain employees or staff or teachers not wanting to come back. They're
Correct.
still worried.
Yeah, I was talking to a teacher, Teresa, telling me that during the non-COVID, all the time, parents, and it's a sad reality, parents have to work, then have daycare, they send their kids to school sick, because in their mind,
Right.
where else are they going to go? And so this teacher was telling me that, he's worried about that. that they're going to end up
Right.
with a sick. But I know GDOE, in their defense, they're doing what they can with the screening. They're.
Right.
I mean, it's massive.
I
It's
think
huge.
they're allowing several options,
Right,
right?
yeah.
So and so we're partnering with them. We're doing a poster series. We're doing a video that is more about self-care and about getting the mindset ready for this kind of interaction. Because they haven't interacted with their classmates, and they haven't interacted with their coworkers
Right.
in the DOE setting for 6 months.
Correct.
And so one of the things I wanted to do is a shout out to John Fernandez, because while we were talking, he basically said that the first week or so is not about hitting the books right away, per se. It's about getting everyone comfortable with each other in this new normal.
Right.
And so that's really putting the student and the employees' concerns first before education.
Right.
I know they're going in for education, but the important thing is you cannot have somebody absorb studies,
Right.
or their lessons if they're too worried about certain other issues, like, am I going to catch it from my classmate?
Correct.
Therese,
we're gonna bring in the vice speaker of the oversight on education, since we're talking education. Vice, good morning. Vice Speaker Talina Nelson joining us now on the Zoom.
Hi, good morning, Chris. Good morning, Sabrina.
Good morning.
Ariella,
good morning.
Good morning. Good morning. So we're on with Teresa, and we're discussing obviously back to school, and she was talking about kind of the mindset of not just the students and the parents, but the GDOE employees in terms of going back to work and the risks that are going to be associated with that. So Vice, we'll just go ahead and fold you into this conversation.
Sure, yeah.
Go ahead.
We've been having a lot of informational briefings and also stakeholder meetings with Department of Education. Some of the areas that we focus on is also the transition of COVID into the school year. And there are some concerns with the teachers being exposed, but GDOE does provide options for the parents, for our stakeholders, on what path they'd like their child to use. So they have distance learning option. Well, I wish GDOE would be here, because they're really the ones that are doing the mountain of the work,
right,
to showcase the enormous job that they've done. They also have block scheduling for our students. In our hearing, they did a video for us, and they showed how each school is implementing 6 feet social distancing. And it's really amazing how the staff and the administration and the teachers and the parents got together and are preparing the schools with, markings of how to keep social distance. Even a teacher displayed alternatives of greeting for social distancing rather than hugging. So this is all the way from the elementary level to the high school level. And GDOE is working very hard to ensure that, we try our very best to keep everyone safe. They've also installed, they also installed sinks for hand washing. They'll also be doing temperature checks. But really the things that we are also focusing on is the curriculum and how teachers are going to be impacted by teaching the same curriculum so many different times to an X amount of students. And so also the exposure of the staff and the teachers. So that is something that GDOE is taking into consideration.
Right.
We did have a stakeholder meeting also addressing special education. There were concerns, especially with the autism spectrum disorder needs, that GDOE has areas to improve upon. And so we're doing a follow-up informational hearing and a stakeholder meeting on our special education needs for our students. We've also done how they would implement social work services, counseling services for our students. We've seen nationally the trends that this COVID-19 has put many people in a state of depression. And also not just the parents, but the child as well. The frustrations of the parents gets passed on to the child.
Right.
And so GDOE is actually training their counselors, and they are making efforts to go out into the community and to just, touch base with the students as well. They have the counselors have their phone numbers for the students to call in if they need someone to talk to. And this is also during the summer months. And so, Ms. Cepeda, Nadine Cepeda, is doing a great job at getting her counselors ready, also and trained for telehealth to provide this kind of one-to-one psychological or even, basic needs assistance for the student and or the parent. So GDOE is doing a mountain of work preparing for this upcoming school year. They've done a mountain of work during the COVID. It's just amazing at the amount of professionalism that the deputy superintendents and their goal focused, and also the teachers and the principals really just coming together. And there were so many roadblocks in the way, but the people that work at GDOE, they always found a solution to serve our community. And so, I'd really like to thank them for that enormous work. And I wish we could have some of the principals and teachers, because they're at the front line,
Right.
dealing with these issues. I wish that they would be the ones to give this interview today,
Yeah,
to really showcase the amount of work that they've done and the
Yeah.
great job that they've done.
That's the thing, Vice, is they're pretty busy
Right,
getting the
and-
schools up.
I think eventually we will try and get them on, but the Guam Education Board, GDOE, they're preparing for a press conference that's going to be held in believe in a half an hour.
Right.
But really, it's
Right, yeah.
wonderful to see this whole interagency, intergov Guam partnership, and the Guam Behavioral Health and Wellness Center. They have not closed, like Therese had said, and they've been working with GDOE, but they've also been working with other frontline agencies, to include the Guam Police Department. And we have Paul Tapau, and Senator Nelson, you are the vice chair for public safety, so it's great to have you on
Right.
while we do this phone call. But so the Guam Police Department, they also went under some training, and I believe it was with the Guam Behavioral and Health and Wellness Center.
Right.
Paul?
Yeah.
Hey,
Hey, good
Fede,
morning.
thank
Good
you for
morning,
having
Sarge.
me.
Right.
Good morning, Mr. Ariola. Good morning, Senator.
Hi, nice seeing you.
Right, Paul, so you GPD, they also went under some training with Guam Behavioral and Health and Wellness Center?
Yes. With everything that's happening, and it's really ironic how it got started. Again, Chief Ignacio had asked a staff officer to do a research relative to what we call the blue suicide issue that was happening stateside, and this was pre-COVID. So with the study that came back, they showed a significant signs of our frontline officers, our first responders, who pretty much didn't have the resource or the availability to cope with the stress associated with the job. So coming back with the findings, and of course doing the research and finding assistance in where we can actually lay help to mitigate these issues that our frontliners here in Guam may be exposed to, we went ahead and formulated through research and of course to grant research, we were able to work with the Department of Justice, and we were able to secure a mental health and wellness grant under LEMWA. And in doing so, we wanted to create, the vision was to create a peer mentorship group within the Guam Police Department. So taking the first steps in meeting with the build team and understanding the needs associated with what we needed to do, we reached out to Guam Behavioral Health and Wellness. And of course, Ms. Ariola has been very instrumental. She was talking about the SAMHSA grant and, dealing with the COVID, issue with suicide. And the team that came out to assist us and provide the training for the Grief Talk, the CIS training, and we're also going to be moving with the Connect, and of course the post issue with suicide prevention within the line was spearheaded by Guam Behavioral Health and Wellness, the Peace Program, so the Peace Team. And I'm also privileged and honored to be a part of that Peace Team. And it's having the likes of Ms. Michelle Sasamora and of course her team coming out and sharing with my peers about how coping, understanding grief, and of course dealing with the idea of suicide, and it's real. You know, we want to address that. The stats show that she did. Ms. Ariola had indicated that the call center that the crisis hotline averages about 25 calls a month. And you know, this is the onset of COVID, 6 months in, 5 months into COVID, and it's the beautiful thing about where we are with our peer mentoring group is that we formulated this partnership now with Guam Behavior as a safety net in which we can work with and are willing to work with Guam Behavior should we need additional advanced assistance in providing care. So, you know, we are taking the baby steps, but these are big strides with moving forward with addressing our frontline workers, particularly with our GPD personnel, not just our uniform officers, but also our civilian support employees, in addressing just mental health and wellness, and you know, understanding that we can, through the trainings that we've received with Guam Behavior, we can address these issues from the front line and from the peers' perspective, so that there's this understanding. So again, Ms. Ariola, thank you to you and your team for affording this opportunity for the Guam Police Department to work again closely with Guam Behavior and
Right.
Health and Wellness Center.
Thank you, Sarge. Vice, I wanted
Thank you.
to,
Thank you, Paul.
Thank you, Teresa. Vice, and I thank you for jumping in. We ended up running late. You know, I had the time blocked off for you, but I wanted to kind of seg into, and we've got about 9 minutes, so maybe we'll do a little round robin. Vice, I have heard you say some very eloquent and passionate things on the floor of the Guam legislature about, you know, addiction and, you know, drugs and the many struggles that face our people relative to these issues. And we wanted to kind of touch on fentanyl a little bit as, you know, there was a raid. And I'm just starting to hear things that are really concerning to me.
Yeah.
And, you know, we'll get Sergeant DePau and then Teresa also to comment on this. But Vice, if you could just give us your take on this, and have you heard, as I have, that fentanyl and, you know, pills with fentanyl are on Guam, and that, you know, people are taking them, and that, you know,
In some cases, dying.
in some cases dying. So Vice, go ahead and we'll give you the floor on this.
Yeah,
And have you heard, as I have, that
so yes, you know, we do have a drug problem on our island, and very little attention is I'm sorry.
it's okay, Vice. I know that this issue is it's very close to you, and that's why we definitely wanted to get your take on it.
So we have you know, I have heard and I have seen of access to fentanyl, and also other opioid pills that are being laced with fentanyl, and we're really trying to push.
This is how you respond. This is how serious this is, guys. So Vice,
Yep.
you know, do not apologize for this.
Yeah.
This is exactly how I feel. I'm on the same page
If
with
I
you.
could, if I
Take your
could,
time. Take your time.
if I
Vice.
could
Take
say
your time.
something,
Thank you, Teresa.
guys. You know, I've spoken with Senator Nelson, and like many, the drug addiction, the drug substance use disorder on Guam hits home. I can't, you know, every family knows somebody, if not the first degree, but definitely second, third degree. And because Guam is very small, it could be a second cousin or a first cousin, but it's like a brother or a sister being hit by this addiction. And so I've spoken to Senator Nelson about this, and so her reaction is a reaction coming that's very personal. We all have somebody that we know. It could be a brother, a sister, a mother, or a father, even. And so the fentanyl issue And the opioid issue is a big issue on Guam. Guam Behavioral Health has several SAMHSA grants that specifically support New Beginnings, which is our drug and alcohol division here at Guam Behavioral Health. We have outpatient programs, intensive outpatient programs, education programs, groups that are offered. We even have peer specialists so that those who actually walk through the experience, who are in recovery, who are addicted or in recovery, can talk. That has been the most effective, known effective strategy to approach others who are going through this same darkness in their life. And it is a darkness. And so we we have one the New Beginnings division is the drug and alcohol division. We have we're here. We've been here. We do outreach and we do partnerships with other nonprofit organizations, or not other nonprofit organizations on Guam, such as Sanctuary for the Youth, such as Salvation Army and Oasis for adult female and male population.
Thank you,
And
Therese.
so,
Sarge, we're
Sure.
really just up against the gun here, and it's my bad.
Oh,
I should
yeah.
have brought this up earlier. But Sergeant Paul Tapau, Guam Police Department, fentanyl on Guam. What can you tell us in 60 seconds?
First and foremost, my heart goes out to the vice and of course everybody that's going through this. And 60 seconds, really, it's not an ample amount of time to address what we're facing with a pandemic. First with crystal methamphetamine, but now with the gradual use, and we're seeing a significant increase of opioids abuse, and of course, we expect to be fentanyl. We're still waiting for results. However, as a community effort, and this is where the community needs to understand, it's going to take a community to address this issue. The Guam Police Department can always do interdiction, but we're moving towards community-oriented policing and doing prevention and partnership with nonprofit organization, and of course, working with the families. We've done this before, and we're going to continue to do it as we move forward with a new norm with COVID, but addressing that this is still an issue. Before COVID, there was a drug epidemic, and there still is a drug epidemic. But collectively, as a community, with the Guam Police Department, all our partners, our stakeholders, our law making bodies within the community, our legislatures, and of course the families that are affected by this, we all got to come together and we all got to address this issue that we have a drug problem and we need to address it. So, we're going to continue to work with them. And again, Vice, my heart goes out to you and the family. Continue to stay strong. Let's continue to move forward, work together, and address this issue collectively as a whole.
Vice Speaker, we're going to close with you. And, I got to say, I'm a fan. I'm very touched that, like I said, this is an issue we've heard you speak about many times. And I'm also, I feel good that you've been having this conversation with Therese and Guam Behavioral Health and Wellness Center. And I really feel like we are at the top of a very dangerous wave that I'm not sure if people know. We're hearing it from the police. We're hearing it from Therese. We're hearing it from the Vice Speaker. The opioid addiction and the fentanyl, I mean, people are... It's a crisis around the world and also on Guam. And so, Vice, we'll give you the last word here. What do you think we need to do?
So, the opioid epidemic and crisis is not just singularly to Guam. It's a national impact. We've been trying to get some assistance with the Allied Health Board to pass legislation to limit the amount of prescriptions for opioid, and also education for individuals who are prescribed opioid, and also requiring prescribers, doctors, to go into the system and see the history of the patient to ensure that they're not doctor shopping. And this is the thing with opioid is you receive the dose upon an injury, and then you become addicted. And then you evolve into something stronger, because in opioid use, there's a tolerance. And so before you know it, you're from taking a Percocet or oxycodone, you're now utilizing the morphine pills to shoot up. And then from that, you go into harsher and harsher drugs. And so the tolerance continues to increase. We do have a lot of programs on Guam, but we do not have the support or the capacity to really to really serve those that are suffering from substance abuse, to serve that have families that are suffering, that have members suffering from substance abuse. And so, I hope that as we move forward, that we start looking and prioritizing really where our money is going to go. I mean, it's nice to have Hagåtña Revitalization Restoration Program, but I'd rather see that go into behavioral health and to push for more capacity to assist those that are suffering from drug addiction or substance abuse and their families as well. So I think that this is a good time to refocus and to really see the needs of our community, and to slice away the agencies temporarily that that do not directly impact the social well-being of our community. So thank you very much, Chris and Sabrina.
Thanks, Vice
And
Speaker.
Thank you, Vice.
Thanks,
thank you.
Therese and Paul.
I couldn't have said it better myself. Therese, thank you so much. It was really good to get you on here. Wow, we just covered a lot of ground.
Yeah.
Sergeant Paul, there
Thank
was
you so much.
Thank you, Sarge.
Thanks, guys.
There's a lot of stuff we wanted to get to you about, but we'll catch up at a later
Yeah.
date. But I just really wanted to use this platform to kind of pierce the veil on this issue, and let's get it out there, because like you said, Vice, like you guys said, Sarge and Therese, we got to talk about it. We got to talk about it. We got to normalize this as part of the conversation. So thank you guys so
Talk
much.
about
Would
it
love
and
to
do
be
something
back on
about
your
it.
show.
Right.
Talk about 3.7 detox unit.
Okay,
Okay.
we'll do
That
it.
could
Right.
be another topic.
Okay, thank
Thank
you.
you.
Thank you,
Be
Vice,
safe, guys.
Sarge,
Thanks, guys.
Therese.
Thank
I'll
you.
see you guys.
Take care. Thank you so much.
Hasta
Stay
adios.
safe.
Wash your hands.
Sure.
Okay. 9:03. Yeah, wow.